Hello, everyone. This is Janet Hill at the Rock Island County Health Department. Thank you for joining us today. It is 3:30 p.m. on May 4th, 2021. Today we have with us Amy Thorson, the Director of the Scott County Health Department, Nita Ludwig, the Administrator of the Rock Island County Health Department, and we have Dr. Olatude, the Chief Medical Officer of Unity Point Trinity. First of all, though, let's start off with some uh, daily numbers. Nita, let's go first, please.
Sure. Today in Rock Island County, we have 28 new cases of COVID-19, and that brings our total to 14,471. We currently have 30 people hospitalized in this county with COVID-19, and our deaths remain at 313.
In Scott County, there have been 21,094 positive tests, and we're seeing a 7% positivity rate over the last week. This is a decrease, but is still higher than the other large counties and the state of Iowa. We have had 239 deaths of Scott County residents. And in vaccinations, 133,558 doses of vaccine have been administered by Scott County providers.
Thank you, both Nita and Amy. Nita, let's go off with your talking points now, please.
Sure. So you no longer need an appointment to get your COVID-19 vaccination at the Rock Island County Health Department's mass vaccination clinic at the Camden Center in Milan. So far, the response has been positive, and within the last hour today, they have given for a total of over 500 immunizations to today's clinic. We're trying to make getting vaccinated as easy as possible by changing to a walk-in clinic. Our team is on site from 8 a.m. to 4 p.m. Tuesday through Saturday. We can give thousands of vaccines a week. You don't need to pre-register. However, you can still make an appointment, and that might reduce your wait time if you like. The links for appointments are going to be available, as they have been, at richd.org and on the Health Department's Facebook page. Not all vaccines will be available every day. Generally, vaccine availability will be Moderna on Tuesdays and Wednesdays, and Thursdays are generally Johnson & Johnson and either Moderna or Pfizer. And Fridays and Saturdays are generally Pfizer vaccine. This, of course, is subject to change as our vaccine supply could change. The health department will post which vaccine we have weekly on the Facebook page and on our website. If this clinic doesn't fit your needs, our pharmacy and healthcare partners are also offering appointments and opportunities every day of the week and into the evening. Getting vaccinated protects both you and our community. Please get vaccinated as soon as possible. Thank you.
In public health, we continue to be COVID-19 all day, every day. This means that we hear lots about the happenings in our community. We want to share what we are hearing now in order to provide correct information and promote 3 things we can all be doing as a community to move through this pandemic. First, get your second dose. The Iowa Department of Public Health has shared that they've seen an increase in the number of individuals who have gotten a first dose of either Pfizer or Moderna vaccine, but haven't gotten a second dose within the recommended time frame. It's important that anyone choosing to be vaccinated understands that you are not fully vaccinated until you've received both doses of these vaccines. The vaccine trials that tested these vaccines only focused on the effectiveness of vaccination after both doses. Don't skip out on the second dose because you have heard from family or friends that they didn't feel good after getting their second dose. Everyone is different and has a different experience. The important thing to remember is that any symptoms you would feel after receiving a vaccine are short-term and you are not sick. You are just having an immune response. Additionally, 2 weeks after receiving both doses of Pfizer or Moderna vaccine or 1 dose of Johnson & Johnson, you will not need to quarantine if you are found to have been a close contact of someone with COVID. Individuals who are only partially vaccinated will still need to quarantine if they are identified as a close contact. We don't want our ability to return to normal to be impacted because we have large groups who are only partially vaccinated. Second, wear your mask. We're hearing that masking is still a topic of conversation, and we get it. It's been a long year. One bright spot is that masks are making a difference. We know this because we have seen huge declines in other winter respiratory illnesses such as flu. We don't have a lot to compare COVID to since we don't have previous years of data to look at. However, we have lots of data on flu, and this year is almost unprecedented. We are hearing from our schools that students are by and large doing well with masking. As adults, we probably think about it more. The general rule is to wear a mask when you can't distance yourself more than 6 feet from others outside of your household, especially indoors. And lastly, contact your healthcare provider if you have COVID and you aren't getting better. We continue to hear that most individuals survive COVID, so all of these precautions are over the top. Unfortunately, about COVID-19 is that we have long haulers, and they are individuals have recovered from the worst impacts of COVID-19 and have tested negative. However, they still have symptoms including ongoing fatigue, joint pain, shortness of breath, loss of taste or smell, difficulty sleeping, headaches, cardiovascular problems, and brain fog. If you are not getting better, please go to a healthcare provider so he or she can evaluate you and determine next steps. These cases are very real, and it can happen to anyone, including people with no underlying conditions or other risk factors and the young. This is a concern because we are seeing a much younger average age of individuals who are testing positive for COVID-19. In Scott County, our average age has dipped down to 33 years of age. Our hospitals are also seeing much younger individuals admitted due to COVID illness. And we do have Dr. Olatude from Unity Point here to talk with us about what he's seeing with their younger patients.
Thank you for joining us, Dr. Olatude. We have a few questions here we would like for you to answer, and then any media members, if you have questions, please put them into the chat and we will get to those after our prepared questions. First of all, we are seeing younger people become infected. What age groups are driving recently rising hospitalizations?
Yeah, thank you. Thanks for sharing. I would say that what we're seeing in the public in terms of overall decline in the age group of patients is what we see in the hospitals as well. I would say that at the end of March and early April, our average age of hospitalized patients was about 36. This was down from an average age of 60. So we've seen 20-year-olds in the hospitals, and we've seen them not just coming with mild illness, we've seen them very, very ill. And we've seen 30-year-olds, we've seen a lot of 40-year-olds. So the average age has dropped significantly. And right now, it should be about 40 being our average age of patients that have been hospitalized. And it's not just that they're requiring oxygen. Some of them are also in our intensive care units.
Okay.
I can also add to that, I know people have asked me that young people always shake off this vaccine, and that is very true. However, some of the young people also are very, very ill. And granted, one of the things we are seeing now is that it seems that the younger population seems to be responding to some of the treatment options we have. Yes, we have over a year under our belt now on how to treat COVID, and that is also helping. And So we're seeing our patients, even though they go to the intensive care units, younger patients there, they're recovering a little faster than what we experienced in November, December. However, there's still a lot of, unfortunately, um, you know, challenges, health challenges that these people face. And so even though we've seen them recover, we have to uh, know that it's probably preventable based on a lot of studies or a lot of what science tells us today, that some of these hospitalizations are preventable when you take the appropriate precautions.
Okay, so piggybacking onto that, we see a decrease in the number of deaths, and we're very, very happy about that. But another serious concern is these long-term effects, such as heart and lung issues. What have you been seeing specifically in patients, and is there a difference between what you're seeing between older and younger patients?
So yeah, thanks for that question. Yeah, the long haulers and COVID is one of the issues of concern. I know one of the challenges we saw with the initial phase and second wave in November, December was that a couple of weeks, sometimes months later, some of these patients come back with what we call respiratory illness and pneumonias. We've seen we have a few patients who survived COVID and were discharged from the hospital after their treatment course, coming back 3 weeks later because they now have a bad lung infection and bad pneumonia. And this is because COVID, the coronavirus, does a lot of damage to the lung tissue. And sometimes it takes not just sometimes, we know it takes a while for the lung tissue to recover. And while there's damaged lung tissue, that can be a real, it attracts infection. A lot of bacteria can sit in there and cause infection. So we see asthma-like symptoms because we see people that maybe younger people and even middle-aged people that could do easily 2 miles walk a day, um, much much long after they have been discharged from the hospital, they're still struggling to complete half a mile because they're still short of breath and winded. So we see some residual effects on the lungs and affecting our breathing as well. So fatigue is another thing we see. You see that it takes a little while for some patients to get back to themselves. They do not feel themselves for several weeks, if not months, because their energy levels are just low and slow to come back.
Well, that's really difficult to hear. I mean, you would think that younger people might be able to recover faster, but that's not what you're saying. You're saying that some folks are um, as sick as older people.
Yes, absolutely. Some are sick as older people, and even though younger people tend to have a stronger immune system and stronger reserve, we still see in some cases, some drawn out residual effects even after they've tested negative for COVID. And you hear some people saying, "I'm not just feeling okay. I cannot do what I used to do," and so it takes for some people a few weeks and a couple of months to get back to normal activity.
Wow. So, do we know whether people are getting sick with one of the variant strains at this point? Or is this just what we've been seeing all along?
Uh, Now, at this time, that's a question I don't have a direct answer to right now. I do have um, a- the medical community really suspects that this what we witnessed in March, April, is likely related to the variants that we're seeing, partly because of how fast it spread amongst the younger population. And there have been very rare cases, probably one or two, where we've seen someone that has been fully vaccinated who also came back and was admitted with COVID infection. So in those cases, we test patients for the variants. And when we see younger people very sick in the intensive care unit, we also test them for the variants. And we're working with the state labs on this. The report back to us is not always specific as to, oh, your patient had a COVID variant, but we know that there's a prevalence which is increasing of the COVID variants in Illinois and in Iowa and
Okay.
in the core cities as well.
Okay. Thank you for that. So, what symptoms should parents and caregivers watch for in children, and has that changed over time during the pandemic?
At this time for children, it has not really changed. it's what we would experience in children is likely going to be simple. What common respiratory symptoms is? It's cough. Sometimes it's an upper respiratory symptom, and then lower energy level fatigue. That's what you see most likely in children, and it's amazing that children, of course, and thankfully they do recover very, very well. By and large, majority do. I know that we've seen in Michigan, for instance, a lot of children that were hospitalized. But in general, for children, parents and caregivers are looking for respiratory symptoms and lower energy levels. Some of them also have diarrhea and upset stomach. But those are just common, I would say, viral-like symptoms that children experience from time to
Okay,
time. Yeah.
thank you for that. So as soon as next week, the FDA and the CDC may give public health and healthcare the ability to vaccinate adolescents 12 and older. How much will that being able to vaccinate that group impact our community spread, do you think?
Hey, Janet, that's a very good question, and I'm excited about that. Really excited because um, we know that adolescents and 12 to 15-year-olds, our teenagers, um, right now some of the spread that we're seeing is due to what asymptomatic carriage in this population. So if we're able to vaccinate them, we're able to get the levels of infection under control. We're able to get better control of the spread of the infection. And we know that it's the younger population, including the adolescents, that the variants affect the most. And they're the ones that have been spreading it faster as well. So if we can get them vaccinated, it's going to be huge, huge, because I know that in our homes sometimes we know that grandparents and when they see their grandchildren, I mean, even though they are vaccinated, they're hugging them. And even if when they are not vaccinated, grandchildren and grandparents, the affection they have for their grandchildren. So if we can get that population taken care of with vaccination, I think it will help a lot. It will help prevent the spread of this of this infection. Because the longer we have the infection around, the higher the chance that we're going to get variants. So if you can get the 12 to 15-year-olds vaccinated as well, I'm all for it. It's exciting to hear that. It's great news. And I think it will really help us get to that state where we can reopen fully and get back to our usual activity.
That sounds like great news to me. You touched us on this a little bit, but what long-lasting worries do you have as a physician for children and young adults, both physically and mentally?
For children and young adults, when we talk about mentally, it's really it's their development that matters right now. It's their psychosocial development, because just the pandemic has affected that piece of their development, and which is why I'm glad to see how that schools are doing well with children masking and going back to class and having those social skills and developing those social skills that are essential to life. And in terms of their health and physically, we know that when COVID affects the lungs, that is what really personally concerned about, that what residual effects, how much will the lungs heal? Would the lungs heal completely? Or would there be a higher rate of, let's say, asthma-like um, symptoms or COPD-like symptoms in young adults that contract the coronavirus? So it's really the lungs that the state of the lungs and the respiratory status, and they will likely be more prone to getting respiratory illness in the future because their lungs were damaged with the coronavirus.
Thank you so much. So the next couple of questions we want you to help us debunk some myths. One of the things that we've seen on Facebook and other places is that some people are worried that the COVID vaccine will affect fertility. Of course, we know that's not true, but tell us a little bit more about that.
Hey, yes, thanks for that question. It is absolutely not true that it affects fertility. I would say that the studies that were done and we compared those who got the vaccine with just those who did not have the vaccine. and there was absolutely no difference in the rate of conception, in the rate of birth, in the rate of miscarriages. There was no difference between the two populations. One of the interesting things with the vaccine research, when we're testing, when it was being researched, it did ask that women who were enrolled should not get pregnant during the testing, because at that time it was not really clear. There was quite a high number of those that got pregnant, and they did not have a higher rate of miscarriages. They did not lose their babies sooner. They had just normal course of their pregnancy, and some of them right now already have had their babies. So it does not affect fertility at all.
Thank you for that. So our last question before we're going to the media questions is, what do you tell your patients worried about blood clots after the pause with the Johnson & Johnson vaccine?
Yeah, the Johnson & Johnson vaccine, and yes, we did find some blood clots which was in about 15 people out of the 7 or 8 million that had received the vaccine, Johnson & Johnson vaccine. One of the things that I would say is that the FDA was very cautious, and rightfully so, in ensuring that we understood the mechanism of the formation of this clot, and we knew how to treat or address this clot. So one, it is we know how to treat it if it does occur. However, the likelihood of it occurring is so low that when compared with what the clots that are associated with the COVID infection, you're more likely to get a clot from the COVID infection than a clot from the vaccine. Because one of the things the COVID-19 does is that it causes clots. And people have had clots after having COVID infection. So the rate of clots is much higher with the infection than with the vaccine. And again, the vaccine, the likelihood of it causing clot, it's so low. I mean, it's less than 1 in 100,000. So I would say that, look, this Johnson & Johnson vaccine, it's here to protect us. The protection it offers is way much higher than the risk. And even this risk of clot, we're aware of it in the medical community. We know how to treat it. We know how to recognize it. And there are a lot of good treatment options for that.
Thank you. Those have been a couple of persistent issues on social media, and it's nice to have a definitive answer here from a local expert. So thank you for that. There's a couple of questions here from the media. It boils down to, are you concerned about medical professionals who are choosing not to get the vaccine?
Yeah. My answer to that is yes, because my fellow medical professionals, they're the front line. They're caring for people. They're doing their best. They're sacrificing to take care of people, and they had a higher risk of contracting COVID-19 because of the exposure to people, and the protection it offers, the vaccine offers, is tremendous. We've seen it. We have seen it even amongst our own staff locally. There was a time we had 150 or more out with COVID-19 symptoms, or what contracted it. Right now, it's barely 1 or 2 that are out with this. We know that the vaccine works to protect them, to protect everyone, especially healthcare workers. And my plea to my fellow professionals, healthcare professionals, is to get this vaccine. We understand that there's some hesitancy in some people, but we have seen it. We have seen it work. We have seen it. It's not just research that showed it. We have experienced it locally here, that the number of healthcare workers that are out with this illness is almost negligible at this time.
Wonderful. That's some good hard data proof. I like that. That is the last of the questions that the media have put into the chat. Let's pause here just for about 30 seconds. And if anyone else wants to answer any questions or ask any questions, otherwise we will conclude for today. We expect to come back to you next Tuesday. And in the meantime, a lot of information is being posted to our websites, our Facebook pages, and togetherqc.com. One other question. What would you say to patients if they knew that their doctor didn't get the shot?
Well, that's an interesting question. And I would say that probably I still do not know one doctor that has not received the shot at this time. I would say that one of the things we saw when we rolled out the vaccination was that I think 99% of the doctors that they actually received this vaccine, and a couple of them wanted to take it later because either because they had recently contracted the virus, um, and they wanted to wait. So right now, I do not know a doctor that has not received the vaccine. However, one of the things I will share with patients is that yes, the doctors are oftentimes and more often than not very reliable, and it will tell you exactly what is going on truthfully. However, you also have a personal responsibility to look at what you think is the right information, you can piece this information together. And doctors should not be instructing patients what to do. We should partner with patients. And whenever we meet with patients, we are partnering with them to get them to better health. So that's the partnership. It's meant to be a collaboration. And sometimes if your doctor is saying something and you're not sure about it, you can always seek a second opinion. You can ask around as well. But I would say that the medical community here, I would say 98, 99% of the doctors have received this vaccine. And those who had not yet received it uh, initially was primarily because some had recently contracted the virus. So um, that's what I would say. It's a doctor-patient partnership and collaboration. It's not meant to be a dictatorship. So therefore, you should take whatever the doctor says and also do your own research and then decide for yourself.
Thank you so much for all of your knowledge and your time. I really appreciate it, Dr. Olatunde.
Thank you.
And I appreciate all the media's time and all of our public health with Nita and Amy. And we will talk to you next week. Thank you so much.
Thank you.
Thank you.